Hello, my name is Katie Dimpfel, and I'm here to talk to you today about sudden cardiac arrest. Sudden cardiac arrest is the sudden, unexpected loss of heart function, breathing, and consciousness. Sudden cardiac arrest usually results from an electrical disturbance in your heart. Sudden cardiac arrest is not, and I repeat, not, a heart attack. A heart attack happens when your coronary arteries, outlined here in the pink, get blocked off and they start to kill your heart. Sudden cardiac arrest happens when your electrical system in the heart, which tells your heart to pump, stops working. It results in ventricular fibrillation, where your heart just sort of quivers and spazzes a bit. Symptoms of sudden cardiac arrest include sudden collapse, unconsciousness, irregular breathing, and no pulse. Sometimes other signs and symptoms preceding sudden cardiac arrest include fatigue, fainting, blackouts, dizziness, chest pains, shortness of breath, palpitations, or vomiting. Cardiac arrest often happens without any warnings. Statistics. 400,000 people die each year from sudden cardiac arrest. Can happen to anyone, any age, any time. Each minute without CPR results in a 10% increase in your chances of survival. So after about 10 minutes without CPR, your chances of survival are down to about 0. After about 5 minutes without CPR, you're down to a 50-50 chance of living. Causes include heart disease, coronary artery disease, birth defects, and arrhythmias, major blood loss, and severe lack of oxygen. A healthy blood vessel looks like that, all nice and clear, no junk in it. That one's a semi-unhealthy one. It has a little bit of junk in it, but not too bad. And coronary artery disease looks exactly like that. Littlest possible space for blood to get through. It's actually horrid. Your risk factors include high blood pressure, high blood cholesterol, smoking, age, obesity, diabetes, and a sedentary lifestyle. The chain of survival has 4 steps. 1 is early access to medical help, which is calling 911. 2nd is early continuous chest compression CPR. Start chest compressions as soon as possible to help the person. 3, early defibrillation, which is a shock on the heart from an AED machine to make the heart start again. And 4 is early advanced care, which is the paramedics getting there and helping your person get to the hospital, get help. Your steps to take for continuous chest compression CPR is first, shake and shout. Hey, are you okay? He's not okay. He's not responding. You check for breathing. Is the heart, the lungs, are they moving? Can you feel the breath on your cheek? And can you hear the breathing? If not, you're going to rub their sternum, which creates pressure and actually hurts. So if they're still awake in there somewhere, they're going to feel it and they're going to yell out, ow. If the person is not breathing normally, you're going to call 911 and bring an AED. I happen to have one on me. Okay, you're going to put your person on the hard floor, hard surface if they are still on a couch or something. Going to begin CPR. Going to take your hands and interlace them with your fingers in between each other. Place the heel of your hand in the middle of their chest, right between the nipples. And you're going to start compressing at a rate of about 100 beats per second, per minute. You're going to keep on with compressions until the paramedics arrive, until you pass out and you can no longer continue compressions, or the person wakes up. If you have a second person here, you're going to have them continue compressions while you work the AEDs. AEDs are super simple. They're relatively idiot-proof. You turn them on.
Plug in training pads connector.
Plug in.
Connector inserted. Training. Press the flashing blue button. Scenario 2.
Okay, you take your pads.
Remove clothes from patient's chest.
Okay, our dude was at the beach, so he doesn't have any clothes on. Super
Peel
easy.
white pads from gray plastic case. in exactly as shown.
There's little diagrams here that show you exactly where they're supposed to go.
Remove clothes from patient's chest. Stay clear of patient.
Listen to the AED.
Analyzing heart rhythm.
It knows what it's doing.
Stay clear of patient. Analyzing heart rhythm. Shock advised.
Okay.
Stay clear.
Is everybody
of patient.
clear?
Press
Nobody's
the
touching the
flashing
patient?
orange button. Shock delivered. Be sure emergency medical
Okay.
services have been called.
Paramedics have
It
been
is
called.
safe to touch the patient.
Safe to touch him.
Begin
Continue CPR.
For help with CPR, press the flashing blue button.
Yay! The paramedics are here. Our dude survived. Huzzah! Okay. Automatic external defibrillator. Creates a shock, goes through the heart, hopefully creating your heart
1
to start.
minute, 45 seconds until announced.
And as you can hear, they are very loud. So that anybody can hear them. Okay. Ventricular fibrillation is when your heart is sort of spazzing out again. Hopefully, when you get the shock, the red line, your heart will continue at a normal rate, start up again, and happy go. AEDs are really easy to use. Turn them on, plug in the pads, put them on the person. Listen for the machine to make sure that the heart, listen to its beat to see if it's supposed to shock it. If it is, you want to make sure nobody is touching the body, otherwise they'll get the shock too. After you make sure that nobody's touching it, if the machine says to, shock the victim. It creates a little zzz, and they will jerk around a bit. Deliver shock and continue CPR until the machine says to do whatever it says to do next. The Good Samaritan law is a wonderful thing. The Good Samaritan law says that if I'm here and I try and save this guy with CPR, I can't be sued if I crack his ribs while I'm doing CPR to save his life. If he survives, everything's happy, which is a good thing. You cannot be sued, any legal action taken against you if you hurt them during CPR. The exceptions to continuous chest compression CPR is near drowning, because there's no oxygen in the person's lungs, drug overdose, or small children. If you find any of those three sort of victims, you're going to wake them up with 30 compressions to 2 breaths, which is conventional CPR. Mouth-to-mouth breathing can cause vomiting in the person. If they do vomit, lean them on their side and try and clear out the vomit. As soon as you do that, continue with CPR. Time to practice. Remember, your hands are their heart until they get to the hospital and they get help. You're the one keeping them alive. Any questions?